So what is the definition, first of all, of a fistula?
Connection.
Abnormal connection.
Between what? There's like a word.
Vessels that shouldn't be connected.
Not vessels.
I don't know.
Hole,
Better word. Yeah,
opening.
two.
Like hollow.
Two epithelialized structures. Okay. Now, does anyone know the mnemonic for what causes fistulas? No? You guys never heard the Friends mnemonic? No? All right, F. So foreign body. R. What if I have cancer and I shoot
Radiation.
beams at you? Radiation. I.
IBD.
That's a good one, actually. Inflammatory bowel disease. I don't think that that's the thing, because you just said it's the thing, but that's actually a very good point. Which type of inflammatory bowel disease is more predisposed to fistulas occurring, and why? Crohn's. And why?
Because of the
Well, it's transmural.
Exactly. So both of those are correct, but the reason for this is there's transmural inflammation. What does transmural mean?
goes through all the
Full
layers.
thickness of
The full thickness of the bowel wall.
Yeah.
So now you have inflammation, which inflammation is supposed to be the eye, but that is perfect because it's inflammatory bowel disease. So I really appreciate you saying that. And it's transmural. So now you have two things. Like I had a guy once, it's like all of his intestine were literally fistulized to each other. It was crazy. Like all the small bowel. Like there were just fistulas everywhere. E. I think E is an end obstruction, like something's blocking you. Pull out some notes on this because now I'm forgetting. N, DS, I think is like sepsis. Again, going with our inflammation. N is neoplasm, I think.
Yeah.
Like so a mass. D is, what's D?
Oh, this one says distal obstruction.
Oh, distal obstruction. Sorry, yeah. What's E?
Epithelial.
Oh, E, sorry, yeah, that's why. E just ties into the definition. D is distal obstruction, and S?
Steroids.
Oh, steroids. Okay, yeah, that's a good one too. So steroids basically cause like everything wrong.
Yeah.
If like you say steroids, like you know, could happen. But all right, so that's what's going to cause a fistula. So back to our kind of previous discussion there. What if someone has diverticulitis chronically? What's a common fistula that we see there in that particular type of pathology? So patient is having recurrent urinary tract infections.
Oh, bladder.
Yeah, colovesicular fistula. So again, we have our colon here. And the sigmoid has diverticulosis. And why does it happen in the sigmoid?
It has to do with the arterial.
So it's the narrowest out of the colon here. So the pressure, intraluminal pressure is the highest. And when you're constipated, that's where these little out pouches are going to happen. So they're going to happen in the sigmoid colon. Diverticulosis gets inflamed and angry, causing diverticulitis. And then your bladder sits over here. And all this, again, two epithelialized structures, inflammation, Friends mnemonic, all of a sudden you get a fistula here. And now they have a colovesicular fistula, and they may be having recurrent urinary tract infections because there's literally poop communicating to their bladder. Or they have, what's the other maybe test question that they present with?
Changing color of the urine.
You didn't fart out of here.
Oh, urine.
Like flatulence out of there.
Not, it's a pneumouria.
Urine.
Yeah, like air in your urine.
Oh, yeah.
Yeah. So that's like the common kind of test question. What's another one in a female that it could fistulize to? I've seen that.
I guess
Oh, the uterus.
Yeah, it can fistulize to the uterus. I had a woman a long time ago. She had stool just pouring out of her vaginal canal. Yeah, so she had a fistula there. So again, two epithelialized structures. We talked before again. Now, say someone had a big abdominal surgery, trauma patient, a big wound on their anterior abdominal wall, again, that's lots of inflammation, eye in the Fren's mnemonic. And then all of a sudden, in the midline of their wound, one day you're rounding, and you go and see the patient, and the dressing on the midline wound is green. Is that a problem?
Yes.
Yeah. So what do you think they have?
Enterocutaneous fistula.
Yeah, an enterocutaneous fistula. Now that's a big problem, okay? So now this can be categorized into what? There's like 2 categories we throw them into based on the output.
High output.
Yeah, so high output, bigger problem, low output. So we need to combat the infectious process that's causing, number 1, because typically then there's like an intra-abdominal abscess or something around there. And then what's our big concern then, more long-term-ish? Nutrition, right? So what would we do to give them nutrition?
TPN.
Yeah, so we can give them TPN. They're going to be NPO because we need to shut this thing down. Then there's a really cool drug for people with short gut, which is kind of a side note. Yeah, Gadex. What's Gadex? You know what's funny? I think Gadex is one of these GLP type things and is around for like a long time.
Yeah.
What does it do?
Is it a GLP-2?
I know nothing. Don't ask me. I know nothing about these at all, but I just know, now that I'm thinking of this, it is one. What does it do? What's its mechanism of action and why it works for patients with short gut?
Does it recycle the bile then?
No. What's in the bowel, in the small bowel, that absorbs?
Microvilli.
Yeah, so it's gonna increase the surface area of the microvilli to help with increased absorption, nutritional absorption. So it's good for patients with short gut. Yeah. I got asked the fistulas, I told you guys, on my general surgery interview at Philadelphia College of Osteopathic Medicine's general surgery program. And I happened to have read it in Surgical Recall the night before. And whoever the surgeon was that was interviewing me was like, tell me about fistulas. And I was like, well, I'll tell you about the Fren's mnemonic. And he's like, oh, excellent. Went well.